Hi, how you doing again? My name is Daniel Segura again on a 3000 show. And today, like I said, we are going to talk about something we all think about, but we're scared to talk about. That's right, STDs. And here I have an expert, Doctora Heredia, to help us talk about this subject. Doctora Heredia, now how long have you been in this field for?
22 years.
Okay, that's good. Now,
enough.
What exactly have you been doing in this field?
I've been working a lot with venereal diseases, treatment, tests, all of that.
Okay, great, fantastic. Now, a lot of people, they have a real misconception of knowing what an STD is. Now, what exactly is an STD?
An STD is a sexual transmitted disease. And sometimes you don't have any symptoms. Most of the time are silent diseases. And we have 19 million cases every year. That means 52,000 every day.
Wow, that's amazing. Yes. Now, how would I know if I have an STD? What can I do? How would I know?
Well, it's only testing. It's the only way you will know.
Now, Doctora, I noticed that we all think about STDs, but we actually don't talk about it. Now, why don't we really talk about this?
Because it's difficult, the kind of culture that we have to pass through that. And it can be very lucky if we can do that. It can be very easy to try to, instead of thinking there's something bad, it's something good, to protect yourself. You know, like how about trying to talk about recycling, to talk about taking organic food, instead of why not talking about testing ourselves for STDs.
Okay.
Because it's a silent, really diseases.
Yeah, and it is. I always realize that too. And my question is, a lot of people were all scared. Oh, you got an STD. You have an STD now. Is having an STD normal? Because that's everybody's scared of it. Now, is it normal? Would you
can say what happened is sometimes you never know. Most of the time, you never know that you have an STD until you've been treated. Certainly, if you are monogamous, you only have one partner, or you don't have any sex, they can be protected. But sometimes you don't smell it, you don't touch it, you don't look at it sometimes because you don't have any symptoms, signs of symptoms, and that can be for years, even to have a symptom. That's why.
Thank you, Dr. Heredia. Stay tuned for Caesar's Diesel Transmission, and we'll be back.
Hello everyone, welcome to Caesar's Diesel Transmission. My name is Caesar and I'll be your host today. Today I want to show you guys some of the greatest and latest technology that we have here at Southwest Career College. This particular frame right here, you guys see, it belongs to a 2010 diesel Freightliner heavy duty truck. And this particular frame right here, it's got some of the newest technology on heavy duty brakes. So for anybody that joins Southwest Career College and all the students that are currently attending Southwest Career College, they are already having the opportunity to learn this type of technology. As far as I understand, no other school here in El Paso offers this type of training yet. So take advantage. Take advantage to all of you to learn as much as you can. This is the latest and greatest. This is the way of the future, guys. So Let me show you a little bit about this. As you can see, instead of drums, it used to be back in the days that, you know, the system, the brake system was drums. Now it's discs. It's a heavy-duty disc system. This is a caliper right here, the brake chamber. The typical brake chamber is a little different. That's the old style. The new style is, you know, as you can see, it's different. It's got a different mechanism inside. The brake pads are inside this particular frame right here. And when it comes to replacing it, all you have to do is pull the little pin, take the little clip off, the brakes slide out, you know, put the new ones back in, and you put the clip back on with a pin, and you're done. Once they step on the brakes, it automatically adjusts. So that's just a little bit of the new technology that we're trying to teach you here, or that we are actually teaching you here at Southwest Career College. Another thing, this engine, we have a new engine over here. This particular engine right here is a DD15 Detroit. One thing that you will be learning on this particular engine, again, this is a 2010. No other school that I know of has it yet. One thing that you're going to learn about this particular engine is the emission system, the EGR system. The new emissions, you have to comply with the law, new rules, new regulations that are coming up every year. So because of those new rules and new regulations, we have to keep you updated with all the new technology that is coming out there in the field. This particular engine is very interesting. Behind this shield right here is got what they call a turbo compounder, and it's actually a mini jet engine that allows the engine to have more horsepower and use less fuel. So when it comes to saving fuel, this is a great engine. There's a lot of new stuff regarding this particular engine, even to change the oil. It's a two-step process. So all of that type of technology is what you guys are going to be learning here at Southwest Career College. Join me next time for another episode of Caesar's Diesel Transmission.
Your time will start as soon as you guys pick up your tools.
Get back. Get back.
Because, we don't feel any symptoms. So what are the most common ones and what are their symptoms?
The most common ones are syphilis, gonorrhea, chlamydia, hepatitis C, hepatitis A, hepatitis B, herpes 1, herpes 2.
Wow, that's a lot.
Yep.
And those are all common ones?
They are the common ones.
Now, I always hear about chlamydia and gonorrhea. What are like some symptoms for chlamydia or gonorrhea?
Like I told you before, it's silent. Sometimes we can have symptoms for years.
So, like, I can have chlamydia or gonorrhea right now and I don't even know
Yes, yes. And you can transmit it.
And I can transmit?
Yes.
Wow.
And the thing is to be tested. That's why it's important to test ourselves once a year. And more if you are between the ages of 17 and 25. It's most common to have been the high risk to be infected.
Okay, now, is there a treatment for, because I always hear people with chlamydia and are you able to cure those?
It's easy treatment, you know. It's only a urine sample, blood sample, that's it. No swabs, no nothing like that.
So will I need antibiotics to actually...
Oh yes, they do. They do, and they can be cured, except the only ones that I cannot be cured is HIV and the herpes. They are for lifetime. They are virus.
Now, what is herpes? Like, what are some symptoms for herpes? Because that's like the big scare. Hear about genital wart and herpes, but you always hear herpes. What is that?
It's like a sore you have when you have flu or high temperature, like a sore they have in your cold sore.
Okay.
But instead of having it in your lips, you have it in your genital area.
Okay.
And there are two types of hepatitis. One is the simplest, the one you have in your lips and your mouth, but in the genital is the herpes too. And they can be very contagious even if they don't have an outbreak.
So if somebody was to have oral sex, if they had a cold sore, would they give me that virus?
Oh yes, that kind plus the one plus the two, plus the genital plus the simple one. They can have both at the same time.
So how can I protect myself? From
using condoms. First of all, it's very important to do that. And not only that, is to use a dental dam for oral sex.
A dental dam? What is that?
It's like a little pouch the females they use in the vaginal area. That's why they can have a...
Now, because I know you told me that herpes is like a skin. It's like a sore in the skin. Now, will the condom protect me? Like, what about genital warts? If I use a condom, will...
Well, certainly, if there is an outbreak, it's easily higher risk to be transmitted for that, to have it.
So even with the condom, if somebody was to have herpes,
because
I can still get it?
They can have around there, if they have an outbreak there, and it's a skin by skin, the touch, certainly you will have it.
Now, what should I do if I think I have an STD?
The best thing is to treat yourself.
Obviously, I don't have any.
There is to treat yourself. It's the best thing. I always recommend that. Do it. If you have something uncommon, like pain when you're urinating, like a sore that you don't know, like a little itching that you don't have in different areas, the best thing is to treat yourself. Okay,
now can someone be tested for every STD and be clean? Like, say, for instance, I want to go to the clinic and I just want to get a test, and they tell me that I'm clean. Am I 100% clean from every STD?
If you don't have another partners, if you are monogamous, you have only one partner, and that partner be tested at the same time like you, yes, why not? You can say, but clean. It's impossible to say that because sometimes the herpes, they cannot have an outbreak saying you have it for years. But instead you're stressed or you're being sick, you can have an outbreak
because it is
even
viral,
for years.
Right? So
exactly.
It stays, you can't get rid
for
of
life.
It, and
for
it's just
life.
on those outbreaks.
Yes.
Okay. Thank you, Dr. Heredia. Now stay tuned for the Millennium Lab Force.
Good morning. Welcome to the Segura 3000 show. Today we're going to be covering a segment on blood pressure and vital signs and blood glucose. Okay, this is Terry. She's one of our MAs here. And today we're going to be looking at her do the procedure. It's a blood glucose.
First, you're going to milk the patient's hand. Clean the area.
And what is this for?
It's for a blood glucose test.
Okay.
It's to test the sugars in the blood.
To test the sugar in the blood.
And it's 100, which is normal.
So she's within the normal range?
Yes. Yes.
Do you check your sugar regularly?
No.
So this experience, it's a good learning experience?
Yes.
Okay. Okay, so from here, our volunteer would go and get their BMI and their blood pressure. And this pretty much will be the helper going on today here. And we're very excited to educate and to help somebody learn about eating healthy.
Okay, my name is Albert Martinez. I'm with the Southwest Korea College Clinical Lab Health Information. Today we're glad to see a lot of alumni here participating, and I'm going to ask some questions on these procedures some of these students are doing regarding blood pressure. Right now I'm going to be asking some students about this blood pressure. Yeah, MA, right?
Yes, sir.
Yes. What was the student's blood pressure?
It was 122 over 82.
122.
122 over 82.
122 over 82. How do you feel, ma'am?
Good.
Blood pressure?
122 over 82.
Okay, students are doing blood pressure right now. Blood pressure is our arterial blood against the walls of the arteries. Blood pressure is important for students to learn. As part of a medical field, they have to be proficient in these fields. And our students, this is a good opportunity for our students to practice and participate along with the other students in these procedures. So that's why we emphasize on this, and this is why we hold these fairs, so the students can get more practice with these procedures and makes them more proficient. You feel you got a good blood pressure reading?
Yes.
Okay. What was your opinion, ma'am?
Her blood pressure was really good.
Really?
Yes.
What would be normal for her range?
Her range is 120 over 80, and she was good.
Yeah. What was her blood pressure reading?
122 over 82.
122 over 80? Okay, very good. Thank you.
Thank you, Millennium Lab Force. Now we're back with the Doraderia, talking about the juiciest part about the show. Those myths, those stories, those home remedies that we always hear about. We hear it on this he said, she said stuff, but we really don't know the truth. Now, Doraderia, let me ask you this first question. Now, this is that #1 question that everyone asks. Okay, can you catch an STD from sitting on a toilet seat or sharing a towel?
No, you cannot. STDs, no. But you can have, if you have lysis or you have, can be possible to have it. For sitting down in a toilet, yes.
Okay, so if somebody was to have herpes or some, I guess chlamydia, and they were just to leave the bathroom, I wouldn't be able to get it if I sat down? If somebody had
only if like it uses like a butter, you can catch it like that and you can destroy yourself. That can be possible, but I don't think so. You will do that.
I would really,
I really
have
recommend
to sit down
that.
and really shake myself.
Oh yes.
Okay.
Shake it pretty well.
Okay, now, ladies and gentlemen, you know that myth is totally false. You cannot get an STD from sitting in a toilet seat. Okay, unless you were to move yourself sitting down on that toilet, which I really highly doubt you would do, it is a possibility to catch lice, crabs. Okay, but you cannot get like chlamydia, gonorrhea, herpes, genital warts. Okay, thank you so much for that. That was the number one question that everybody had.
Yes.
Now, let me ask you this other question. After sexual intercourse, if you wash yourself, could you get rid of the STD?
No.
If you were to,
No, you cannot. You have always, with treatment, depends, first of all, is test yourself and know what kind of venereal disease and they test it. That's it. And the treatment after that.
Oh,
yes.
Wonderful. Again, ladies and gentlemen, this myth is no. You cannot cure yourself by washing yourself. Okay? Dove is not going to help. Shampoo is not going to help. Okay? It is false. Thank you so much.
You're welcome.
Now, let me ask you this question. Is it true that you cannot obtain an STD from oral sex?
No, it's not true. You can. You can. Yes, it's less than having an intercourse, vaginal or anal.
It's the same thing.
It's less. Less the possibilities, but you can have it. Oh yes, it's not a safe sex. In oral sex, yes, you can have an STD.
Okay, ladies and gentlemen, again, oral sex is still considered sex and you can still get an STD. It's not as likely as actual sexual intercourse, but you can absolutely get an STD from oral sex. And as well as anal sex, correct?
Exactly.
So
that's why it's very important to protect yourself. Protect, use condoms, and be happy.
Thank you. Now we have this is kind of like a good question. A lot of people always think, oh no, you can't get an STD from this. Okay, this is another misconception. Dr. Heredia, can an STD be transmitted through sex toys?
Yes, they can be transmitted to sex toys. Most of them, the syphilis is one of the most ones that you can get it through the sex toy. That's why it's very important to disinfect and only use it with one partner, no multiple partners.
Thank you so much. Again, be careful what toys you play with, okay? Because yes, if it is a sex toy, the STD could be transmitted. Now, thank you, Dr. Heredia. Now, stay tuned for Dr. Pararelli's autopsy protocols, and we will conclude our segment with Dr. Heredia. Thank you. Hello, and welcome to the first episode of Autopsy Protocol with Dr. Pararelli. Now, Dr. Pararelli has a lot of experience in forensic science. Now, the most important part for forensic science is to find out what leads to the death of a person. Now, Dr. Pararelli, what are you going to talk to us about today?
Today we're going to discuss the death of Marilyn Monroe.
Fantastic. Now, we're just going to leave you with Dr. Pararelli.
This evening we're going to discuss the death of Marilyn Monroe. This is one of the most fascinating deaths in the history of the United States. Not necessarily because of the medical facts that surround it, but because of all the people who she was associated with. What is very clear to most people who investigate this is that it is a clear suicide. Dr. Noguchi, who was at the beginning of his career when he did the autopsy on Marilyn, said that it was a probable suicide. 20 years later, after all sorts of further investigation, he called it a very probable suicide. There were 5 documented suicide attempts by Marilyn Monroe. The most interesting part of Marilyn's death is the fact that in her digestive tract, there were no elements of any pills found. Yet, there was a significant quantity of Nembutal and chloral hydrate in her blood system to cause the death. This is where the inexperienced people start to believe that there is a conspiracy. Dr. Noguchi, in his examination of Marilyn, examined every inch of her body for needle marks and was unable to find any needle marks. This suggests that the drug had to be administered elsewise. What those people ignore is that her liver content was much higher than that of her blood content of each of those drugs. This suggests a parenteral, or entry via the digestive tract, where it comes into the portal vein to the liver first before being dispersed out to the rest of the body. This is very suggestive of the fact that these drugs were taken somehow through the digestive tract. Most of the problems in this case deal with the statements made by Marilyn's friends. What is not clearly understood is that these people existed in the Hollywood culture, so it was all about making them as close to Marilyn as possible. So their statements are in many cases implausible, if not impossible. One person claimed that Marilyn was picked up by an ambulance, taken to a hospital, then returned to the death scene. This is extremely out of the ordinary behavior in any type of case. Further, how would that person know that the ambulance was taken to a hospital had they not followed that ambulance? The temperature of the body at autopsy at 10:30 in the morning was 89 degrees. This showed that, based upon the fact that the body loses 1.5 degrees per hour, that she probably died at 4:06 in the evening. This shows that both her maid, which actually was a psychiatric nurse, and her psychiatrist were present at the time of the death if you use that formula. However, using body heat is not a very accurate method of determining the time of death. It does give a rough estimation. Every death examination requires a death scene examination, an autopsy, and a toxicological examination as well. The toxicological examination in this case was very incomplete. Though we have accurate records for the liver amount of phenobarbital and the chloral hydrate, as well as the peripheral blood, we have no record of the metabolites of that. Had we had the metabolites available, we would now be able to understand at which point she took the drug, how well she metabolized the drug, and at what time that drug was taken. While by today's standards, the autopsy of Marilyn Monroe would be considered to be substandard, at the time it was considered state-of-the-art. So while there are many things by current standards that are missing, it is my concurrence with Dr. Noguchi that Marilyn Monroe did die, very probably of a suicide.
Thank you, Dr. Patarelli. And now we're back to finish off our interview with Dr. Heredia. Now, we're going to finish off with some of the rest of the student questions that we have, okay? And the myths. These are the myths not with everybody, okay? Now, Dr. Heredia, does any kind of birth control protect you against STDs?
No, they protect you against pregnancy.
Okay.
But not STDs.
Not STDs?
No. It's birth control.
Birth control
for the pregnancy.
So if a girl was to tell me, oh, I'm taking the birth control pill, I'm okay, I don't have any diseases, can I still get an STD?
Oh, yes.
Okay.
If she's infected, yes, certainly.
Okay, thank you. Again, you cannot protect yourselves with birth control pills, okay? Number 2, can you have an STD without any symptoms?
Yes. It's very frequent, and that's why it's very common, the STDs, because they're silent, no signs or symptoms, and can be for years, depends on the venereal diseases. That's why, again, test yourself.
So all those rumors all the time you hear, oh, I'm good, I'm clean, I don't have any symptoms. It's a possibility that
never
I could have something.
Never. Only if they both as a couple or they go in and test themselves and wait for the results.
Okay.
And don't have any more relationship with another
other people. So the main thing is that we both have to go test ourselves so we both know that we're both clean.
Exactly. At that moment.
At that moment. And then have sex with nobody else. So if I happen to get a disease, chlamydia, or five months later, I then know that, obviously somebody's been cheating, huh?
Can be possible.
Could be possible. Okay, I have another question. Okay, there's a birth control called implantin. Why does it continue to be swollen and hurt after it's been removed?
Well, what happened is under the skin is installed there. Okay. And what happened is sometimes there can be one of the nerves in the type of insertion. You use like a syringe to insert it, and maybe you move one of the nerves and being implanted there for 3 years is implantation there. Okay. That's why after they remove it, that nerve gets still inflamed and can take a time.
So eventually it's going to get better.
It depends on the people, but there can be more weeks, but yes, can go away.
So over time, maybe a month, 2 months, to be a year. It all depends on the person.
No, it's less than that. If more than that, it's better to be checked. But
checked out again.
It's always take a little longer to get okay.
Okay, that's good. Now, what if a pregnant mother was to have chlamydia? Mm-hmm. Okay, now, what would be the proper thing to do to get treated while she's pregnant or after the baby's born?
No, when she's pregnant. First of all, when you are pregnant and you have a care from the gynecologist, they always test you for all the STDs, all of them. Okay, if they have something positive, they will give you treatment. Okay. Certainly, it's very good to have it when you can be treated when you're pregnant.
Because if it's not treated, it eventually passes through the baby.
Oh yes, through the placenta. So few of the venereal disease
to get it treated while they're pregnant.
Yes, correct.
Okay, thank you, Dr. Heredia. Now I have a last and final question. Now again, this is your own opinion. What advice would you give the students at Southwest Career College about STDs?
Learn about it and test it and treat it and be happy.
Thank you. Thank you, Dr. Heredia. Now that concludes our segment with Dr. Heredia and STDs. Again, these are those things that we think about, and I'm here to ask them for you. Okay, thank you. This is the Segura 3000 show, and I am Daniel Segura. Thank you, Dr. Padarelli. And now we're back to finish off our interview with Dr. Heredia. Now we're going to finish off with some of the rest of the student questions that we have, okay? And the myths. These are the myths, not with everybody, okay? Now, Dr. Heredia, does any kind of birth control protect you against STDs?
No, they protect you against pregnancy.
Okay.
But not STDs.
Not STDs?
No. It's birth control. Birth control. For the pregnancy.
So if a girl was to tell me, oh, I'm taking the birth control pill, I'm okay, I don't have any diseases, can I still get an STD?
Oh yes. Okay. If she's infected, yes, certainly.
Okay, thank you. Again, you cannot protect yourselves with birth control pills, okay? Number 2, can you have an STD without any symptoms?
Yes. It's very frequent, and that's why it's very common, the STDs, because they are silent, no signs, no symptoms, and can be for years, depends on the venereal diseases. That's why, again, test yourself.
So all those rumors all the time you hear, oh, I'm good, I'm clean, I don't have any symptoms. It's a possibility that
never
I could have something.
Never. Only if they both as a couple or they go in and test themselves and wait for the results.
Okay.
And don't have any more relationship with another
other people. So the main thing is that we both have to go test ourselves so we both know that we're both clean.
Exactly. At that moment.
At that moment. And then have sex with nobody else. So if I happen to get a disease, chlamydia, or five months later, I then know that, you know, obviously somebody's been cheating, huh?
Can be possible.
Could be possible. Okay, I have another question. Okay, there's a birth control called an implanton. Why does it continue to be swollen and hurt after it's been removed?
Well, what happened is under the skin is installed there,
Okay.
and what happened is sometimes there can be one of the nerves in the type of insertion. You use like a syringe
Okay.
to insert it, and maybe you move one of the nerves and being implanted there for 3 years is implantation there.
Okay.
That's why it can, after they remove it, that nerve gets still inflamed and can take a time.
So eventually it's going to get better. You
And
just gotta give
depends,
it a while.
it depends of the people, but there can be
everybody's
more
different,
weeks
right?
one, but yes, can go
Okay,
away.
so over time, maybe a month, 2 months, to be a year. It all depends on the person.
No, it's less than that,
Less than
but
that?
if more than that, it's better to be checked. But
Checked out again.
it's always
Okay.
take a little longer to get okay.
Okay, that's good. Now, what if a pregnant mother was to have chlamydia?
Mm-hmm.
Okay. Now, what would be the proper thing to do to get treated while she's pregnant or after the baby's born?
No, when she's pregnant. First of all, when you are pregnant and you have a care from the gynecologist, they always test you for all the STDs, all of them. Okay, if they have something positive, they will give you treatment.
Okay.
Certainly, it's very good to have it when you can be treated when you're
Because
pregnant.
if it's not treated, it eventually passes through the baby.
Oh,
right?
yes, through the placenta.
So
Few
it's
of the venereal
a must
disease
to get
get
it
those.
treated while they're pregnant.
Yes, correct.
Okay, thank you. Dr. Heredia, now I have a last and final question. Now again, this is your own opinion. What advice would you give the students at Southwest Career College about STDs?
Learn about it and test it and treat it and be happy.
Thank you. Thank you, Dr. Heredia. Now that concludes our segment with Dr. Heredia and STDs. Again, these are those things that we think about, and I'm here to ask them for you. Okay, thank you. This is the Segura 3000 show, and I am Daniel Segura. Hi, and welcome to the Segura 3000 show forum. Now we have some special guests. We have Mr. Marquez right here. We have Ms. Capita. You have Dr. Petarelli. And if you all know for a special interview before, Dr. Heredia. Now today in our forum, we're going to talk about what pretty much what our whole interview was on sex education. And I got to admit, Dr. Heredia, you know what? I went home right after that and had to get the condoms. I had to get the condoms because you know what? You have to have condoms, and you know what? It's everywhere. You can go to Walgreens, you can go to the gas station, anywhere you want to. All different kinds. You know, Trojans right here. Okay. Now, kind of want to talk about some of the issues that we are having with sex education with kids. Now, what do you guys think? Do you guys think maybe we should have sex education classes at a younger age?
I believe it would help.
It would help?
It would help. And on a continuous basis all the way through high school, I believe that they had a yearly prep of what's available to them in regard to contraception, and not only that, to protect them from other VDs.
Now, what grade do you think, Ms. Capita, what grade do you think would be an appropriate age? Like,
I feel
grade?
that they should start at the secondary level of education, which is around, I would say, 6th grade.
6th grade?
Unfortunately, statistics show that sexual behavior is being engaged at the age of 12.
12?
Oh, yeah.
Therefore,
Yes.
That is the problem. What about, what age do you think, or what grade do you think would be a good...
9th grade, 10th
9th grade?
something like that.
9th grade?
Yes.
9th grade, 10th
Yes.
grade? To be honest, originally I'm from New Jersey, and I believe, you know, I started having sex education classes when I was probably in 3rd or 4th grade, believe it or not. 3rd or 4th grade. Now, do you think that's too young of an age?
No.
No?
I don't believe so.
3rd? So what about we kind of push it down a little bit, maybe 3rd or 4th grade? What do you guys
Well, it
think?
can be better. If
Yeah?
you could use it like a science class, you could use a sex class. Why not?
Okay.
Well, I
that-
feel that not
you
so
see
much in
them-
a science format.
What about you?
Well, what's the problem is you're taking the time from other instructional areas. So if you repeat this course every year, which is the same material, you're taking time from other, not as important, but certainly important material that they need to be taught in the school.
But you don't think we can still, like, kind of like squeeze it in there with the sex education every year? Maybe like, what, an hour?
Oh, yeah.
A year? 1 hour?
What is going to change in that year that you're going to need to take that time from instructional time into the same material you've covered before?
You're going to prevent teen pregnancy, which is our biggest issue in the United States right now. And since they're engaging in sexual behaviors at the age of 12, I believe that it should start at 3rd grade, and they should be advised so that they can learn, especially about some of the STDs that they can get. They can also, the girls then can get HPV at such an early age, which will give them cervical cancer. And I think just in teen pregnancy alone is awesome, because look at how much it's costing this country.
What they're not discussing is the failure rate of these. These reduce the pregnancy rate. They do not eliminate it. They also reduce the STD rate. They do not eliminate it. The holes in the latex are far larger than the HIV virus, which is not being discussed in many of the courses.
Now, let me ask you guys this question. Now, say we were to have, because this is the other big debate, okay? Say we were to have these sex education classes at a younger age. Do you think that's kind of promoting them to have sex? Because that's the big debate, like why, you know, we don't want to have these classes. Do you think that's a misconception?
Oh, yes, it's a misconception. How it can be possible? That's why we didn't get to that point for that reason. They always say, oh, you're promoting that. Well, you don't give the students a birth control. Why? For that reason, you know? They think when they say when they give them that information, they're going to promote doing that. Isn't that true?
That's not true?
No,
As a matter of fact, a lot of the studies and a lot of the new programs have shown that sex education at an early young age, individuals are now, all our young kids and our teenagers are making their own choices to delay having sexual behaviors because now they're having facts versus them having no facts and then experimenting on the unknown and getting into a situation which now medically it hurts them. And it's long term.
And if you show them where are the secondary effects that happen with not treated venereal diseases, you know, they can be infertile, they can be deafness, blindness in their babies. There can be a lot of things that they need to know that way before they engage in that.
Right. Mr. Marcus, what about you?
Because they get secondhand information from their friends.
Exactly.
That's what makes it dangerous.
Yes, that's where we got all those myths from. A lot of those myths that we hear about is pretty much from our environment. They never learned these myths, right, in the school setting. It's important that they understand that I cannot get an STD from sitting in a toilet. It's important that they do understand is that I could get an STD from having oral sex or anal sex. Either or.
Oh, yeah.
Now, what do you think? Do you agree on that?
Yes or
yes.
The previous empirical data, which I have reviewed, suggests that promoting or discussing the sexual matters in the school actually does increase the sexual behavior in that age range.
Yeah, it might increase it. I highly doubt it will increase it, but I do believe that they do it in a protective manner. You know, they'll be more protective, more cautious.
Well, like, I am not sure where that information comes from because according to all of the abstinence programs that came into play 15 years ago, and now we have all those studies and all those statistics, the reduction has occurred. So therefore, I'm not sure where you're getting that information. And this is coming down at a federal level from all the different, from the NIH, and doing a lot of this research. And abstinence with sex education is showing better results than no sex education whatsoever.
Provided you have a school district that will use the abstinence education, which is highly politicized and politically charged.
Okay.
In El Paso, it's a very, very popular program, and a lot of schools have it.
Right, but you're discussing things on the national level.
Also on the national level. Abstinence programs are one of the most funded programs right now, and they continue to throw a lot of money at them due to the success rate of them.
They are more successful than some of the previous ones, but you're still encouraging behavior when you're discussing the use of condoms. You're never discussing the failure rate of them.
Well, but it's not about condoms. We're talking about sex education. We're not talking about condoms. And if you're going to discuss also, and some of the help needs to come from home and from the parents being willing to discuss this with their children. But we're not, sex
Totally
education,
agree.
it has nothing to do with condom usage.
Now, obviously, you know, we're human beings. We're going to have sex. Okay? We are all going to have sex. That's why we're here in this earth right now, is because we have sex. It is in our gene. It's our natural instinct to have sex. I'm sorry to tell you this. So to me, it doesn't matter, okay, yes, oh, because I went to a sex education class, you know, I'm going to have sex. No. It's in our gene, okay? We are going to have sex, okay? Now, it's important to have sex in a protective manner, the way I think about it. So regardless, we're always still going to have sex. Now, wouldn't it be better to be safe than actual sorry?
Well, you're not ever going to be safe. You're going to be safer.
But that's where you can maybe focus the program on a yearly basis more and more. As they get older, right? Children grow, their minds expand. You can be more precise in saying, okay, we first told you about a condom, but now we're going to tell you why it fails, why you just don't depend on it.
Why don't you just do that all at once and be done with it and use that time for other instructional material?
Well, that's what he's saying. Just maybe once a year.
Once a year.
Once a year.
But it has to be
once
continuous.
a year.
Because if they're too young, they're not going to capture all that. I mean, there's still men old enough that still don't know how to put on a condom.
Same thing like studying.
It has nothing to do with teens. So
You're-
maybe failure rate of the inability of condoms not being very safe is because actually men don't know how to put them on.
There's young ladies right now. They think that if they get on the pill, okay, I save them from being pregnant, and I won't get a venereal disease also.
Yep, it's true. That's the big misconception also.
I fully concur.
So if we go into the classroom and explain, wait a minute, you do have that risk of getting a venereal disease, even if you are on the pill.
I see. And why can't the physician who prescribes this to them tell them that?
Because the physicians are too busy trying to make money and will not spend enough time on educating.
I do not concur. Physicians are totally motivated by esoteric motives. They're purely concerned with the health of their patients, and money is secondary.
But not on education. They will dedicate time to just deal with a diagnosis, but if there's one of the biggest failures in it is lack of education. So a lot of these young teenagers go to their physicians and they come out never really understanding why they got prescribed a contraception, an IUD, or an implant on, and they really don't even understand the secondary effects. So I believe that that's why now a lot of the nurse practitioners are really not providing primary care. They're providing more education, and they spend more time doing that. So that's a plus.
And even if you take it a step further, when you go to the pharmacy, a lot of times all I have is that little insert, and it's up to the patient. And are you going to have a 16-year-old girl go all the time and read the whole thing, the pros and cons of that contraceptive?
Oh, no.
No, they're not going to do that.
It is a function of the pharmacy to sell the drugs, not educate the patient.
Exactly. So as educators, we must educate the student.
So it falls under the education system, and people who specialize to also provide that type of education. It's still part of science.
That's why we're asking you they can do it at younger at school.
And I've said repeatedly, this material only needs to be covered once. It doesn't have to be covered yearly. You can remember the material from the years before.
You're never going to remember a material from the years before. If you're at 11-year-old, they don't even remember to pick up their clothes from Monday.
How many different ways? How are you going to change putting one of these on over the next 5 years?
I want you guys to think about this. I want you to think about this, Doc. When you would study, would you just read that paragraph one time and remember it? Or sometimes would it take you to read it multiple times? It's the same thing. Sex education is the same thing. Sometimes they have to see it over and over. It's repetition. So eventually, finally, it gets on the subconscious level in their back of their mind.
I agree.
Whether it is to how to open a condom and put it on. Sometimes it might need a repetitious thing. You know. Well, thank you, ladies and gentlemen. Thank you. This is pretty much our concluding the Segura 3000 show. I would like to thank our guests, Mr. Marcus, Ms. Capita, Dr. Patarelli, and Dr. Heredia. I apologize. Heredia. Well, thank you. We'll see you next time. Thank you.
Thank you.
Three.